Hello, everybody. Welcome to Mental Health TV. We're really excited for tonight's episode. We've got some fantastic guests, and we're going to be talking about really important innovation called Nurse Lifeline. But before we do that, let's go to Vanessa to say how you can join in and how you can ask questions and participate tonight, because we always love to hear from you. Vanessa?
Lovely. Thanks, Nicky. So I'm Vanessa Garrity. I'm going to be covering the social media tonight. We'd love you to join in the conversation. You can do that in a few different ways. If you're into Facebook, if you go on to the Unite MHNA Facebook page, you should see, if you tick to like the page, you should then see the live feed pop up, and you can comment there and you can watch the live stream as well. And I'll be monitoring that and looking for any comments and questions, which we can feed through to our guests. If you prefer Twitter, you can go onto Twitter and just look up the hashtag MHTV. And again, I'll be keeping an eye on any tweets. And if you've got any questions for our guests, do ask them via Twitter or Facebook. And that's it from me really for now. So I'll keep my head down tonight, but any questions, I'll feed them into the discussion.
Fantastic. Keira, would you like to tell us a little bit about yourself?
Hello, I'm Keira. I am a nurse by background, adult nurse. I've spent my short career so far in emergency nursing and critical care, and I've now taken a small sidestep into primary care as well. I'm also co-founder of Nurse Lifeline.
And now your partner in crime, Natalie.
Yes.
Natalie, could you tell us about yourself?
So I'm Natalie. I am also a registered nurse. We actually both qualified together in 2017. I have a background in ED and critical care, done a bit of overseas work in humanitarian settings and also in the RAF Reserves, and I am founder of Nurse Lifeline.
Fantastic. So tell us, what is Nurse Lifeline?
It's a good question. Where to begin? It's been a really long journey, really challenging journey, but a really positive one too. So I think it's really important to highlight actually that pre-pandemic, nursing, midwifery, general healthcare roles were a pretty tough gig. You know, I think that's kind of to some extent been overshadowed by the pandemic, that we were struggling long before the pandemic was about. So back in 2019, I had personal experience myself of burnout and really just feeling overwhelmed by the number of colleagues that were struggling in various areas, and sitting back and thinking, we need to do something about this. You know, there were definitely formalised support services out there, but often there were long waiting times and people felt a bit inhibited in accessing those because, you know, they thought maybe they wouldn't get it, or that people would look down upon them thinking, oh, you're a rubbish nurse or a rubbish midwife or rubbish student because you can't cope. And we suddenly thought, wouldn't it be amazing if after a normal shift or after a really bad shift, you know, whatever kind of day you've had, you could just ring up and chat with somebody who gets it, someone who potentially understands and can relate to what you're going through. You know, you have to put things into context. You don't have to explain what you mean by the terms you're using. You don't have to worry about burdening them so much because it's just a space to offload. And so really that's where the concept for Nurse Lifeline was born. And I managed to get some fabulous people on board, dragged Keira under the bus with me, some other fantastic colleagues, Sahar Nitfor and Sarah Driver, nurse and midwife respectively. And we had no idea how we were going to do it or how we were going to make it happen, but we knew that it had to happen. We felt so impassioned and driven to see change, to see sustainable change, and really do something tangible to support our colleagues nationally in a new way that hadn't been seen before. And it's been a really, really challenging journey, like we said. And there have been several points on the way, you know, particularly as the main significant setup phase was during the pandemic, literally in between our own shifts, night shifts in intensive care, trying to recruit volunteers and find funding and set up as a charity, build a website, and the list goes on. And we had no idea, again, how to make it happen. And we kind of learned as we went, and we've had some brilliant people join us along the way. And we're so grateful to have that support. And we're at the stage now where the service is live. And we've got almost 50 volunteers on board. People can ring any weekday evening between 7 p.m. and 11 p.m. And we've got long-term aims for the listening service to be a 24-hour service. Middle of the night, if you're on a night shift or wherever you are, that you've always got someone there that you can just pick up the phone and chat with without an appointment, completely free, confidential. And the idea really is that it might be enough for them to have that space to offload and feel connected with another person and just chat with someone who gets it. Or it could be a step towards building the confidence to seek ongoing support where needed. So that's where we're at, really.
Keira, was there anything you wanted to add to that?
I think just to add, I think that the peer-to-peer listening service, so all of our volunteers are nurses and midwives by background that have been trained in support skills. And I think that the listening service was absolutely at the core of what Nurse Lifeline was. That was the inspiration. But what we really are trying to create is a community of positivity around nursing, and where people feel able and in a position to seek support if they need to, but also just to build a positive community of nurses, because it's such a brilliant career to be in. And I think that it's nice to just share experiences and build relationships, across countries, so between Scotland and England, or in different trusts, to share experiences. So we are, although the phone line is at the core of what we're doing, it is about building a positive community of support as well.
And so you're saying even before the pandemic, things were tough for nurses. What sort of issues were you coming across that made you think we really need to do something?
I think, it's pretty broad, isn't it? But lots of people working in high pressure environments with no recognition that continued exposure to what we believe are normal experiences can end up having an impact on your own well-being and mental health. Staff shortages, that kind of thing, poor working environments, not understanding, how to escalate concerns if you've got them. And I think, maybe not being aware of the challenges you might be faced from a student nurse. I think you go in, excited and blind in some ways, which is great, but it doesn't last very long. And I think that, my view is that you need to be prepared for that as a student, and then it wouldn't be such a blow, I think, when you do get out on the floor. So there's some of the things that I experienced personally.
Completely, yeah. And I think the whole thing about burnout, it manifests in so many different ways, and there are several definitions. But we were actually chatting out. I've got a really rubbish analogy for this that really helps me to kind of explain what it feels like. And other people have kind of related to this. And if you're not an ICU nurse by background, you might, someone will probably call me out on my rubbish anatomy and physiology. I'll say this is complete rubbish. But if you picture an asthmatic patient who's ventilated in intensive care, and there's this thing called breath stacking or air trapping, and they're taking in breath and they have this auto peep, and eventually there's no more room to take in breath because you're not blowing out. And for us, it sounds really stupid, but Nurse Lifeline is that space for you to breathe out and take a full breath in again. You need someone to flipping disconnect that ventilator tubing and decompress your lungs and let the air out. And that's what we're doing. That's what we're encouraging, is that it's just that space. It's whatever you need it to be. Maybe you want to ring up and talk about how work's going. If you're struggling with something, maybe it's some other big event that's happening in your life, or maybe you want to ring up and talk about something completely random that's unrelated to anything that's going on, just to take your mind off it. And that's what we want to be, really. And like Keira said, just go beyond the listening service and create that empowered community. And that's what we've really seen with our volunteers. Our volunteers are incredible. They've contributed so much to the development of this, and their passion is really what's driven it. Again, doing this and volunteering to cover shifts in between their own substantive post shifts. And really for us, the training aspect of it was really important, wasn't it, Keira? Yes. That we managed to get training delivered to all of them in support skills and suicide awareness via the Helplines partnership. And that was really important to provide that foundation for us, because we're not mental health professionals. This isn't a mental health intervention. It's just regular average Joe nurses and midwives, although I would say the volunteers are exceptional. But, the concept is that it's just your regular average Joe nurse or midwife connecting with other regular nurses and midwives. But we wanted to be able to provide that extra support to facilitate that listening environment, and really with the suicide awareness thing, to ensure we actually had a bit of criticism from someone a few months back saying, oh, are you really sure it's appropriate to be doing suicide awareness training with volunteers? And we, so absolutely, we to us, it's like CPR. We think everyone should have an understanding of suicide prevention and suicide awareness. It should be fundamental, like teaching first aid and CPR. And I think to us, if someone is feeling that way or having those thoughts, if they, we would much rather they came to us if they felt they couldn't go anywhere else. We want to be that space too. We're not a dedicated suicide prevention service by any means, but we want to be able to, if someone does approach us, keep them safe until we can get them to the right support. And I think that was really empowering for the volunteers. We actually did a really great workshop earlier this week with Dr. Annetta, just to have those conversations again around suicide and what it means to us. And I think part of what we're pushing for around this cultural shift around how we view mental and emotional well-being, again, is acting as preventative intervention for ongoing issues and potentially influencing rates of suicide attempts and things, normalising talking about how we're feeling at an early stage, like Keira said, as a student, as a newly qualified preceptee, ingraining it within the profession that we should be talking about it so that it doesn't build up cumulatively and knock us over the edge,
Absolutely. And you said it was a couple of things I'd like to just circle back to. So the first one was this is pre-pandemic. So we all started pre-pandemic. So we've had these issues in nursing as a nursing family for a long time around how we treat ourselves at work and what we expect as like normal levels of well-being or lack of well-being. And I'd like to think about that if you're okay to do that in a second. But also I think you were sort of saying how difficult, it's been sort of setting up during this COVID period. And I guess I wonder if maybe you feel comfortable to share with us what that experience has been like working as an ICU nurse during that time, because we saw.
You sure you want to know?
Yeah, I think so, because there was a lot spoken about kind of like the well-being and the emotional well-being of staff, and then we had the strange clapping, which was great, but PPE and pay would have been nicer. So thanks very much for the claps. I have some.
And would have been a bonus. Yeah.
But so I just wondered if you'd like to talk on either of those subjects, and we'll circle back. So one was about the experience during COVID, and the other was what's going on in nursing that we behave this way to ourselves and to each other sometimes.
I saw a really interesting post on social media by a doctor who is an influencer, but it was it highlighted a line in a book saying that burnout shouldn't be a badge of honour, and I think that in nursing as well as other healthcare professions, it almost is. You are, it's seen to be positive if you're working in these acute areas, picking up extra shifts, managing to have, double the patient load you should be having, whilst trying to be a competent, confident practitioner. It's expected that you should just be thriving in that environment, and actually that isn't the case. But I do think we are beginning to see a slight shift in that mentality. But I don't know, what do you think, Nat, about that?
No, I agree. I think that line about burnout not being a badge of honour is really great, and really thought-provoking actually for many reasons. For me, it's not the whole badge of honour thing. It's not about look at me, I'm doing great. It's more if you're not doing that, it's that you're not meeting those expectations, you're not doing enough, and there's that guilt that's associated with that. And you kind of, again, the whole hero ideal that we spoke about previously, that the sentiment I imagine behind we're all heroes and clapping and things was well intentioned, I believe.
Yeah, I think so.
But then we know this has been well documented and spoken about a lot, that actually by calling us heroes and having that expectation, it made people really fearful and reluctant to come forward and say, hey, I'm struggling and I'm not a hero and I'm not doing what I should be doing. And it was great to have some positive public support for the profession and for all, the healthcare sectors. But it was quite short-lived, and I think that really took its toll as well, to just kind of be dropped when
it did kind of feel like it was such an immediate decline in support. It almost felt, and we know, working in healthcare, that we are absolutely not through this. It's still going on. We're still seeing we haven't had a decrease in winter pressures throughout the summer, and we're only going to go into another winter. And to know that actually that support it did appear to be short-lived, it does feel a little bit demoralising, doesn't it? I think, sorry, go on.
No, carry on.
I was just going to talk a little bit about the barriers, I think, to seeking support in nursing. And I think that we are seeing a lot of wellbeing projects set up at a local level, which is really amazing. Although there is some disparity in that depending on which trust you work in, it's brilliant that we're having wellbeing projects and champions at a local level. But what we found anecdotally from chatting to other people is that people are a little bit reluctant to access that support at a local level. And I think that's for various reasons. I think that a lot of it is that seeking support is showing an element of vulnerability, and at a local level, being vulnerable with a colleague in an area that's potentially has an expectation of you to appear resilient, which I don't really like that word either, but it's all about how it appears, isn't it? It is, that's a huge barrier. You want to come across as someone that is competent and able to do your job and to the best of your ability to care for your patients. And I think that it is a worry that if you do show a sign of vulnerability and weakness is the completely wrong word, but I think that's how it is perceived, that your colleagues will find you, maybe have that view of you that you could be incompetent or, not able to do, which is completely incorrect. But I think that is sometimes the worries that people do have from speaking to other people as well.
Absolutely. I think there's a huge fear around that at all levels. And I mean, we're encouraging staff, whether you're junior, band 5, band 4, band 2, or whether you're the chief executive of a trust, you need to recognise that we need to break these barriers down. But the only way that's going to happen is through doing it together, continuing to open that conversation around it. And I think going back to the kind of our experiences during COVID, it's really hard to imagine behind those doors of the ICU unless you're there. I know we focus a lot on ICU, but that's because it's our own lived experience, and we know the research shows us that those staff have been the most adversely affected at this stage. Behind those doors, we've had media we had cameras and things streamed online and to have a glimpse, but that's a few seconds, and that was our reality day in, day out for a really long time, and still is in many areas. I think it's important to recognise the toll that it's taken. I know perhaps it's been over talked, but we've been there. We've filled the syringes and held the hands and turned off the ventilators and phoned the families again and again and again. I think a lot of us, we were coming home to empty houses. We were isolating for our own families, and there was no one there to offload with. And like Keira said, sometimes, I mean, it's great if you've got a support network within your peer group. But even then, sometimes there's this feeling of, if I'm not offload with Keira, for example, maybe, I feel a bit guilty because I don't want to burden her because she's also experiencing this huge pressure herself. So that's the idea with Nurse Lifeline is that it's anyone, anywhere connected by that common experience, that shared understanding, that you're removed from the immediate situation. You can offload and never go back again, or you can ring us the next day and speak to someone else. It's just that safe space that we all need sometimes. I think recognizing that we need that is fundamental to move forward and to recover from this. And we'd love to see it as a permanent service that's, like we said, 24/7.
Absolutely. Let's go to Vanessa. I'm sure you've got some questions you'd like to ask as well.
No, just listening to you talking there, and I was thinking about trauma. Certainly, from being a mental health nurse, I think, as you've just described, really, that the trauma doesn't necessarily happen while you're under extreme stress. It happens afterwards. So perhaps we haven't yet seen, the full psychological impact on the nursing workforce and, the rest of the NHS workforce who've been dealing with it. I mean, I know, certainly when I've worked in very acute areas, it's often afterwards, isn't it? Because you're in firefighting mode while you're dealing with an emergency. So I guess I'm wondering if you're starting to see cases of people who are coming forward who are maybe experiencing trauma, and also we talked about suicide as well. So where do you refer people onto? Do you signpost people onto other services if people come to you? Because I can imagine that potentially you could be dealing with some quite significant psychological trauma, suicidal ideas, people who've got kind of quite high level mental health needs. So curious how the service responds to that.
Yeah, so your first point about, only the realization of what you've experienced only happening afterwards, I think is a really valid point. And we are seeing that now as we've had a bit of an ebb in what we've experienced, but it's still there. So it's hard to gauge, when things are going to surface. Someone mentioned recently, actually, a really interesting comparison, that people get sent off and deployed to war zones, and it's really traumatic, but it's only for a specified amount of time. And we're in this position as health workers, as nursing and midwifery professionals, as healthcare assistants, but actually at the moment, there's no end in sight. Maybe it'll ease and we'll have peaks and troughs, but at the moment, this is just a reality that, in the early days, we thought, a few months, few weeks, and this is an ongoing, permanent thing now. So
I think there's something about that, though, that's important to know about the sort of COVID fatigue as well, isn't there? Because I used to be involved in doing sort of psychological support and debriefing following critical incidents years ago, so particularly, suicides, or somebody was seriously assaulted and that kind of thing. And one of the risk factors that we screened was what you said about whether people are going home to an empty house, what support they're getting, any other vulnerabilities they're having. But it strikes me from listening to you that obviously the sort of avalanche of COVID sort of challenges and issues means that, we can't provide that for people. And, does it seem like it's sort of becoming more normalised that, that nurses go to work and experience that level of stress?
I think it is, and I think that definitely my experience was that in the beginning it was almost that we had that adrenaline, everyone pulled together as a team. It felt incredible that you were able to go to work. For one, you were able to go to work and do a job, but two, you felt like you were making a positive impact, and you felt like you were helping, which was invaluable, I think, for me during the start of the pandemic. And I think a lot of workplaces did feel like that. They felt like for the first time they'd been, given resources they wouldn't have had before, and everyone worked together as a team, and you felt that you were all in it together. And I think that it's, like we say, that's now tapering off. That sense of burnout and COVID fatigue is beginning to happen, because it's just not sustainable. It doesn't matter how amazing your team is and how much sleep you get, it's still, it's going to happen, because it's ongoing. And I think that and we know that mental health services are stretched for everybody. So, and as a nurse, like you say, you do feel like you're not entitled to seek that support sometimes. You're like, no, I'm the carer, I'm the person that is looking after the public or my patients, and therefore I shouldn't be using up that capacity for myself, So, I do think it is an expectation within nursing that you are going to go to work and it is going to be stressful, and that's just how it is. That I do feel like that is sometimes the culture.
Absolutely. Just going back to what you said, Vanessa, about the kind of the suicide aspect of it. Again, just to reiterate, so we aren't, again, a mental health intervention.
No, that's what I was saying.
But we've the calls we've had have been really varied so far. It's amazing to see calls coming through we always said, didn't we, Keira, that even if we just helped one person, it would all have been worth it. All the sleepless nights would have been worth it just to help that one person. But the calls we're seeing so far are so varied, from newly qualified nurses, from students, from people who have imposter syndrome, who are anxious about new job roles and new working environments, nurses and midwives who are retired, people who are going through finished practice, which we can't advise upon, but they just want that space to offload impartially and chat with someone who gets it. We haven't had so far, thankfully, anyone who's actively feeling suicidal, but we've had people who have felt suicidal in the past and are kind of just wanting to talk about that and process what it means for them. But again, there's that fear thing, isn't there, Keira, which we're hoping we can break down through the fact that it's peer-to-peer. But again, so when we were talking with Dr. Nessa the other evening, actually asking that question it can be such a relief for someone, because when you're feeling burnt out, you're feeling rubbish, or you're having those suicidal thoughts, carrying around and wearing that mask day in, day out and pretending you're okay is exhausting. And to have someone ask you, are you feeling suicidal? It can be a really scary thing, especially for volunteers who are new to this kind of thing, to ask. But it can be such a relief, and the lifting of the burden is felt by the person if they're able to say, actually, yeah, I am. And so we've got some really fantastic algorithms that are in place to handle calls like that. And Tim Coupland's been instrumental in helping us to do that. And so the RCN and the Mental Health Forum and Nicky supported us as well to make sure that we handle that safely and, if appropriate, escalate to receive more clinical support or immediate care if needed. There's a really important thing for us related to that about supervision for the volunteers, because they're contributing, again, so much of their own time, and they find it really rewarding. We're seeing that so far, a really therapeutic experience for themselves to be able to contribute to something bigger that, outside of their own roles. But supervision is something that was fundamental for us to ensure that their well-being and safety is safeguarded and comes first and is a priority for us. So at the moment, they have every 8 weeks, whilst we're still, growing the service, they have a reflective group debrief session where they can bring any experience in practice and discuss it and talk it through and discuss lessons learned and how they handle things. But there's also the piece about one-to-one ad hoc support if they need it. And we've got a great structure where the team, they work in 3 or 4. So there's always somebody on shift at the end, an on-call coordinator to debrief with and discuss how they found it went. So putting our volunteers' safety and well-being first is essential for us.
Absolutely. I guess we're sort of hitting half an hour now. So let's have a quick think about making sure we've covered everything. So you've talked about, the sort of nature of the problem and why we set things up. And I guess maybe it'd be useful to look at what you want to happen in the future, where you think this is going to go and what you would like to see. I'd talk a little bit about that.
I think Natalie and I have spoken at length about, what we envisage for the future. And I think that the key take home is to just, what we'd like to see is just to lower the threshold for people access and support. So you don't have to have had something really awful happen to you to give us a call or to access any kind of support that is more suitable to you. One size doesn't fit everybody. But yeah, just knocking down those barriers and ensuring that people feel able to access support. I think that is the primary thing for us that we'd like to see. We'd also love for the service to, outlive us and be a 24/7 service, that we're there for everybody whenever they need us, and not just during our opening hours, because we also know those times don't suit everybody as well. And I would love to see the nursing community come together and support each other and do create that positive, empowered environment, because I think that's so important. And there's so many of us that we can make a real change, can't we? It can be a real driving force. Yeah, I think
it's something we want other nurses and midwives to feel proud of, because it's of the profession, for the profession. It's something that's been created by them, really. It's not about us, we're the little people in the background. It's something that the profession can really kind of take ownership of and say, this is of us. Look what happens when we pull together and we feel driven and we feel pushed to overcome challenges and reach out to each other and support each other. And I think it's really hard, we've discussed kind of already, your identity as a person when you are a nurse or midwife or someone in the health sector is so intertwined with who you are. It's really hard to have that boundary of but I think because we put so much into it physically and emotionally, and you often come home with not much left inside, you feel quite drained all the time. But there are obviously so many positive moments. But because you give so much to it, it becomes your identity, it becomes who you are, which in a way is great. But in a way, it's also really damaging, because it's like, if that goes wrong and if that's not going well, if you're feeling loads of pressure in that role, who are you outside of that? When that's taken away, what's left? Who am I? So I think it's really important to have those conversations about identity and about who we are as individuals, not just as nurses or not just as midwives. And really, encouraging those conversations is a big thing for us. Who we are outside of our roles and how we can support each other to recognise that too. I suppose really we just want to use this as an opportunity for it to kind of be a call to action to anyone who might watch this, or anyone who knows someone who might be struggling. And like Keira said, even if you're not struggling yet, using it as a normal thing, becoming part of your routine, that maybe you ring up 10 minutes or an hour or however long you want it to be, and just download that information. We've actually been fortunate enough to have Sarah Lister joining our team actually very soon, who's the head of psychological and pastoral support at the Royal Marsden and author of the Marsden Manual. And she's a nurse counsellor and is very supportive of the peer-to-peer model, and talks a lot, like Keira said, about how over time the things that we consider normal, they have a cumulative effect on how we're feeling, and using that space to just download, get rid of it, and then move on. Sometimes it's enough to maintain that homeostasis, that balance that we need, and retain that identity, and kind of that transition between work mode and home mode. We're really bad at, I think, collectively. That's maybe a stereotype, but it's hard to switch off sometimes when you get home. I know Keira and I have both woken up at 3 a.m. sometimes and thought, oh my gosh, I've forgotten to give that, or I didn't switch that off, or, I think your subconscious takes a while to come down from that high level adrenaline mode, all systems go. So using this model to just kind of, whatever you need it to be, time to decompress, time to transition between work mode and home mode. If you're feeling anxious about a shift the next day and you need a pep talk, you want some encouragement, or you want to just run something by another nurse or midwife, or you are really struggling, that's what we're here for. We've actually, one of our big aims is that we want to reach all nurses and midwives in the UK, so at least everyone knows about us. Maybe they don't want to use the service right now, but we've developed Keira developed these fantastic little cards. You might not be able to see them on screen right now. Designed to be kept in your purse or wallet, just like your organ donation card, an integral part of your handbag or bag or whatever, and that maybe you don't need it right now. Maybe in a week or in a few months or next year you'll see it and think, oh, hang on a minute, I'm going to give them a call. I could do with that right now. And it's about everyone feeling entitled to do that. I think we need to feel like we're worth that, investing a bit of time in ourselves to process how we're feeling and verbalize how we're feeling. So I think when you verbalize things, it helps you to process it and think about it in a different way and have a different perspective on it, possibly. So our aim is to get these into the hands of every nurse and midwife and healthcare assistant in the UK, and students too. I think the piece on students is really, really important to us, because it's a tough time to join the profession.
It really is. But I also think, aside from if you didn't want to access our helpline at the moment, I think that the message is to prioritise your own well-being. It is not sustainable if you're not doing that. And we've got lots of resources on our website, but there are lots of amazing ideas and tips and tricks online as well. So just, prioritise yourself every now and again. It does a world of good. That would be what I would say.
Absolutely. A really useful thing to think about, isn't it? Because I can remember the times in my career when I thought I was doing really well. It was often the times when I really wasn't doing that well. When you feel like, no, I've got this together. And then you think, actually, it's not I've got this together, it's just I've stopped feeling anything.
You're disengaged from
and it's really dangerous. It's really dangerous. And I think luckily being in mental health, you can't avoid supervision. Not that you should avoid supervision, but it can be quite difficult, can't it, to actually acknowledge painful experiences and challenge and feelings of failure and feelings of anxiety. And I think you're right that almost, because nursing is an integral part of you, but it's also a role, isn't it? So you speak differently, you look different, you dress differently, you act differently as a nurse. It's part of you, but it's not your whole self. And it's very easy for it to become a mask that covers you up instead of something which means that you give better care. And I think it's really interesting to think about how we do divide people into good and bad nurses, or resilient and not resilient, when the fact is that vulnerability is a free-floating thing, and we're all vulnerable at some times and some circumstances, and that's right. Otherwise, we would lose our ability to empathise with each other and to have compassion for pain and loss and fear and anxiety. I can't imagine anything worse than being looked after by a nurse who has never been afraid or never been in pain. What an awful experience. You'd be probably being looked after by like a robot. It would be awful. So we have to allow that side of ourselves to come through, and we have to sort of cherish it and acknowledge it, I think, and actually give it some space to breathe, because you can't give good care without being vulnerable sometimes. And it's really important that we don't shame people for those feelings. And also, I remember one thing that was really, I remember from being a baby nurse, and I was on an adult ward, which I have to say I hated with a fiery passion. But I did meet one matron who was both terrifying and hilarious. And there was one nurse who was like going around saying, I haven't been to the loo all shift. And this matron just turned around and said, "You'll be no use to me with a kidney infection." It was just like, that was the end of the hero.
Brutal, but true.
But it's true, isn't it? I'm like, nobody gets better because you suffer.
No, exactly.
You are not sleeping properly, and you're coming to work and you're not well enough to be at work, or you're not taking a break. After a little while, you're not helping anymore. You're creating an expectation of a toxic environment, which you may decide to accept. That might be your choice. But what about the student nurse coming through who's watching you do all these really poisonous things and stop thriving, and they're learning that this is how you be a good nurse? Because a lot of what we teach people, we teach unconsciously. You say, oh, you must take your break, but if they see you not take your break, or you say it's really important to share, to share how you feel and to teach your supervision, but they see you skipping out on that side of things. We teach such a lot with that kind of hidden curriculum. We think we're teaching one thing, but actually we're teaching something completely different. So I do really think that what you're doing is important. And I have to say, and I always sound really insincere whenever I say anything emotional, I feel really pleased and proud that you guys are doing that. And mildly embarrassed that mental health nurses didn't think of it. But okay, it's still okay. I'm still okay with it. But I think, Vanessa, there's a question, I think, with a mushtag.
Yeah, there is. I'm just going to find it. It was quite a great question. Mushtag's been a guest previously with us as well. So, the question is, she thinks it's a fantastic idea, she says, first of all. Currently, the only people that get it might be other healthcare professionals who are already overburdened. And then she writes, I think it's inclusive that carers, families and friends could use the helpline. Which is the crux of the question, really, as often they are the forgotten support network, and sometimes you don't want to share with colleagues, so you're more likely to share with somebody at home. Perhaps the problem is the workplace, so having an external organisation where you can be validated is very valuable.
I'm really, really excited by this question. I'm so excited.
Great question, yeah.
Because some people have turned around and said, oh, are you sure the remit of the service is right? Have you got the right balance here? But we are for friends and family of these staff groups too, which is so important to us, because again, that thing about us coming home, and if we've got no one to offload to, we're offloading to the people that are in front of us if they're there, and it's hard again for them to understand really what that means, and it can be quite overwhelming to experience that, and that the whole risk of vicarious trauma is a thing, isn't it? We all know that. So the idea of giving them space to offload, or say my partner, or who my family member or my friend is struggling, what can I do? Or if they're struggling themselves, I think it's so important that we recognise that and talk about that too. I don't know what you think, Keira.
No, fully agree. I fully agree. We've obviously been met with some challenges in kind of our approach and what we think is important for the service, and I think it's so lovely to hear when someone else is on the same page as you. So totally wholeheartedly agree that they are just as important.
And we're really, really keen, actually. We've got a really robust data capture framework. I think it's really important for us to measure what we're seeing, and the relevant data is processed properly. We're in the process, the earliest conceptual phase of getting ethical approval to do that. But I think this kind of intervention, it has potential, has real potential to instigate other initiatives and other change at ground level. I think that's the key piece again for us, is that it's at ground level. And it'd be really interesting to see how that progresses.
Do you get any funding from the NHS? Or is it at the moment completely self-funding?
We've actually been, fortunate enough at the moment. I mean, a lot of our cash has gone into it, we have to admit, in the very early days. But we were fortunate enough to receive funding to get off the ground from the COVID healthcare support appeal. Who are a subsidiary of the RCN Foundation, which was fantastic to have that support. So we're so grateful to them for that. But we desperately now to enter the growth and sustainability phase to get people fundraising. We've had people running marathons already and loads of amazing fundraising events. So if people want a challenge, then that's another call to action, I suppose, is that
But I guess it would be good to see the NHS, wouldn't it? And public sector organisations put funding behind it, and maybe, as you start to evaluate, that's where you'll have the evidence to say that, this could be rolled out at a much, much bigger level if you had the right resources. And, it could still be run, couldn't it, as a grassroots sort of organisation, but with some funding behind it.
Yeah, absolutely. And we've actually had great support so far from the CNO team. MOA's been really supportive of us and acts as a sounding board at several stages. But I think that there is also, as a kind of caveat to that, the appeal for a lot of people we've spoken to of it is that it sits independently, that it isn't part of a union or the NHS or whatever else. It's outside of that, which to some people is appealing because there's not that risk again of the fear and the workplace stuff. But again, there's no one size fits all, but I think collaboration is really important.
I do get that. But I mean, I think, like I used to work for the NHS Leadership Academy. So, we put funding behind organisations and movements that were led by, clinicians. So it doesn't mean that, the big claws of the organisation have to kind of come in and take
not at all. It'd be amazing
and run it. But I think, an appeal, if anyone's listening, that
any
people out there.
It's worthwhile, isn't it, for future?
Yeah. We would be hugely grateful for any long-term funding because that is huge. It's massive to, for the project to be sustainable and to outlive us guys, which we'd really like to happen. So, we would be hugely grateful if anyone can put us in contact with or has any great, amazing ideas that we haven't thought of. But
we're just so grateful and so again excited about the potential of it and how it's brought us all together during a time of real uncertainty that we've had this to focus on collectively. So it's
fantastic. It sounds like those are almost our final thoughts then. Is there anything briefly that anybody wanted to add? And before we do that, we don't have time really to go for questions, but I do have a couple of WhatsApps from students, one of which is saying how amazing you guys are.
About that.
And there's another one that has that weird emoticon with like the smiley face and the hug.
Is that a hug? I think that's a hug. Thanks. We'll take that.
Big fan of virtual hugging.
So I think it is important, and again, as I was saying, this is what role modeling looks like, isn't it? Getting up and showing that nurses have the power to make change when they see something that's not right. So it's super, super impressive. So is there anything you want to leave people with, apart from if anyone has any particularly long-term funding?
Give us your money. That'd be amazing.
One parish note is actually, we desperately want, I think it's really important to have, patrons and high-level ambassadors, but we would love to see ground-level student ambassadors and representatives, newly qualified ambassadors, to fly the Nurse Lifeline flag where they're from and take that on wherever their career takes them. And so if people are keen to support that, we'd love to come and do presentations in your university and see how, to empower you guys too, to say you're part of this, you have the power to create change and be a part of this journey too.
Fantastic. Vanessa, was there anything you wanted to add?
No, I just think the point that we talked about in terms of burnout was really important, and Nicky sort of elaborated on that, and I was nodding my head a lot because I think burnout isn't necessarily the people that are off duty, it's the people that are on duty that are avoiding patients, that are feeling emotionally numb because of their own sort of psychological pain and trauma, and as Nicky said, don't realise it at the time. So I think it's about recognising that as well in colleagues, because they might be the people that don't come forward, but somebody else might recognise the changes in behaviour. And so I think it's just a really important point that everybody's raised, but I wanted to re-emphasise it at the end really as well.
Absolutely. So thank you very much, everybody. Been fantastic to see you. Natalie, did you want to add something? I feel like you did.
So if you want to call us tonight, anytime we're here. But again, if you notice other people who've got those warning signs, if you know someone who's a bit withdrawn, a bit quieter, give them a card, send them the link to our website and tell them about us. So sorry, I'll stop now.
Okay. Thank you very much, everybody. And it's so fantastic to have spent time with you guys tonight. And thanks everybody for watching. Take care. Bye-bye.
Thank you so much.
Good night. Bye-bye.